Okay, very good. I'm happy to be here this morning. I'm hoping I can explain what how teeth in the same day is even possible, and also I'm going to show you guys some ideas on how if one of you guys are going through this particular problem, that's probably why you're watching it to begin with. I'm going to give you some suggestions on how you can get the treatment that you guys actually do really need. Um, which is the plan today. So, without further ado, I would probably give at least another few more minutes for more people to come in, and then we can start this live. Unmute. No, I want to know who's here. That's what I want to see. Are all of you able to hear me? If you could just say yes in the chat screen, it'll be really exciting. Okay, very good. Okay, I'm going to give it another 2-3 minutes. Okay. The live chat, you can also shoot me some of your questions. And at the end of the live chat, I will probably look up all the questions and I'll post some answers for you. And if you guys left your phone numbers for us, I will have someone contact you, and then I can probably invite you guys for a consult in the office if that's something you guys want to do as well. Okay. Jason. One more minute, people. Just one more minute. I have some questions regarding insurance and money, and I will definitely try to answer those questions as we go through this little presentation. Okay. Also, at the very top, there's a pin message. If you click on that, you can actually fill out a form. It basically gives me just your name and number and email address. This way, one of my staff can call you back and they can give you any information you need. Okay. And questions regarding insurance, questions regarding how can I afford this treatment? I know it's not cheap. I know it's expensive. But how can you possibly afford all of this can be answered. Sure, if you need to have a lot of money for these procedures, they say. Not necessarily. We can make it work even if you don't have so much money. If you just have a small down payment, you can make it work. So let's talk all of that in a few minutes. I think I'm ready to start right now. Let's go. Okay, good. Teeth in the same day. Is it even really possible? Okay, so because of the advancements that I have in my life, and I've done in my life in the last 5 years, just specifically for having people who come in with no teeth or broken down teeth or completely damaged teeth, and I can just transform them completely in one day, the entire smile back. It's possible today. And that's only because of the advancements I've made in technology and also our skill set as a team, we are able to do a lot more than other dentists can. This is not done by a one person. It has to be done by a group of people. So this is where you need expertise from a multiple dentists, but you still need someone who can manage all of them, be a chief architect for your mouth, and that's me. Okay, so you come in to me hoping that you can change the smile. As long as I can understand and duplicate exactly what you have in your mind, and I can duplicate it with myself, then I can create that exact same look for you. Like the two people on the side that you see, these two guys, the first guy, he had all of his teeth removed when he was 18 or 19 years old. He's been living with dentures since. And obviously, he's showing his denture off, saying that, okay, I don't need this anymore. I have my real teeth now. So now it took him a long time. It took me a long time to convince him to get this procedure done, because he thought it was just not possible. Because every time you went to somebody, they said, oh, you don't have enough bone, you can't do it. So whether you have bone, whether you don't have bone, whether you have good teeth or bad teeth, if you want to create the ideal smile, as long as I can understand what you want, I'm able to deliver that result to you every single time. Okay, good. So let's talk about, why do you think you need even teeth? Okay. What does teeth do for you? Teeth, to begin with, it'll boost your confidence. People, when they have their teeth, are able to do a lot more things. And people, when they have good teeth, are able to talk to people, do amazing in their jobs, and they are more confident about themselves. That's just the truth. And I don't care what anyone else says, but that's just the truth. Okay. What does this teeth give you? If you look at this lady on the left side, the same person, when she didn't have teeth, her appearance and her facial appearance is completely different though. Her face is gone inside. The teeth are all broken down and bad pretty much. But the same person, once you give them teeth, it gives the lips and the face the support it requires. Therefore, you look like a normal person. Okay. And look at her. She's so happy, and she's happy to do whatever she wants to do, which is truly what we're trying to get at. It boosts confidence. Obviously, it also gives you back your facial support and appearance. Okay. What else can you do? People, when they lose their front teeth, especially top and bottom, their speech differs completely. You can no longer speak normally. You speak funny, okay? And that will go away. Now you can speak properly like a regular, normal person. And one of the most important things is food choices. People, when they don't have good teeth, they will just eat any kind of food that's easy to swallow pretty much. When you don't have, especially your back teeth are the ones which mush and chew and grind, and you can swallow your food. When you don't have those teeth, if you're missing a bunch of them, even if you miss one, it becomes a problem to eat. But then as time progresses, you get used to it and you think it's fine. Then you lose another tooth, another tooth, another tooth. Eventually you have no back teeth. And you think, if I'm a front six teeth in the top and the bottom, it's fine. Sure, maybe for your lip support and your facial appearance, yes. But for the food habit, it's a very big problem. You'll start eating all junk food, which will then cause other kinds of medical problems, which is why healthy food is very important. And for you to have healthy food, you need to have good teeth to eat and chew, okay? And I think one of the most important things is your social life can be significantly affected if you do not have good teeth in your mouth. Okay, what happens when you lose your teeth? Okay, simple is this. Your bone strength, which is the most important thing that I don't know if everybody knows that or not. If you are missing teeth and if you have some teeth left in your mouth, just feel your jawbone where you have your teeth, and then feel the jawbone where you don't have your teeth. You will see a significant difference. It'll be sunken in, and you'll feel like it's much more skinnier than where you actually have your teeth. And for those of you who don't have your teeth at all, it is like this though. Basically, when you had teeth, you have had a much bigger, thicker area. And as time progresses, the body feels that since you have no teeth, there is no reason for it to create new bone for you. It's an automatic mechanism. And that is the reason why people do not have teeth. When they don't have teeth, they have a lot of bone shrinkage, and they feel very different. They look very different. They look very old. You can be 40 years old, but you look like you're 65 because you have actually no bone there. Okay. As I said here, you have facial collapse. It's the same person with teeth and without teeth. Okay. Your nutrition significantly declines and you start eating junk food. Junk food is easy to swallow. It's definitely not healthy though. So you have to decide if you want to stay healthy, you want to live longer, or just want to eat junk food. And I'm not saying junk food is not tasty. I eat junk food too once in a while, and you should be able to eat too, but don't make that your regular food though. Okay. And obviously, when you don't have good teeth, or you're missing all of your teeth, you've lost all of your bone. The next best option to create that facial appearance back to normal are dentures. But there are problems with dentures too. As dentures press against your jawbone, you lose more bone and the dentures don't fit. Eventually, dentures are sitting in a little cup or something like and filled with water, and that's probably what you leave it. That's where you probably leave it there. Okay, you'll never use it again. Okay. What else can happen? You can have pain if you have a few teeth in your mouth, which happens in my practice every day. I see people coming to me. All they were missing was just a couple of teeth, which they could have fixed. But whatever reason, busy lives, they probably didn't have the time, they didn't have the money, a lot of these things, or they would just say, why do I have to make this decision right now? Okay. And that causes, by just you ignoring that simple thing, it will cause pain somewhere in your mouth. And that's just the beginning. And that pain becomes more increasing pain. And then you will have to do something desperately at a point of time, which is not worth it. I'd rather have you plan this properly and do it than do it because you have to do it. Okay. Also, when you don't have good teeth, smiling becomes very, very stressful and difficult. So I have plenty of patients who come to me, tell me why they are not able to smile. They're not able to smile in their pictures. They can't go to a social gathering. They can't even talk to their colleagues comfortably because they're uncomfortable without teeth in their mouth, or they have these partial dentures which wobble and move in their mouth, so they're unable to talk and be comfortable with them. So if you want to avoid any of these reasons, I think you should consider having some teeth. So obviously, we have to look at, why did you get here in the first place? Was there a reason why this happened? And I think this is one of the most overlooked parts. I want you guys to see if you guys fit into one of these areas, though. Okay, and then we'll probably find your solution. Because if you don't know why this happened, you will never figure out why you should fix it and how you should fix it. Okay. Number one reason is because you had a lot of dental work done. Dental work will go bad over time. That's true. An average dental work from 2 years to 10 years is the maximum life of any dental work. Okay. So, but again, if it's done very, very well, and if it's well taken care of and well followed up with, you can have them for 15, 20 years, just like a car. You can buy a car, a very expensive car, and you can beat it up, and that car has gone bad in like 2 years. Or you can buy a very, very nominal priced car, even for $10,000, $15,000. And if you managed it well, you maintained it well, and you took care of it, maybe that same car can run up to, like, I don't know, 400, 500,000 miles. Okay. So it depends on how well you take care of it. But the problem with teeth is you use it every single day, and you use it a lot. You use it for talking, biting, chewing, all kinds of things. So there's obviously a shelf life for your teeth, especially if you had work done. So you need a lot more maintenance than normal maintenance, which means you have to go see a dentist not once every 5 years or 3 years or 2 years, even not even twice every year. If you have a lot of dental work, you got to go see a dentist 4 times a year just to make sure everything's intact. And a cleaning is not a lot of money. $150 will take care of that, or $120 will take care of it in my office. You will just come in regularly for a cleaning just to make sure you don't have these gum diseases, you don't have these broken fillings, or you don't have this decay. Okay. Gum disease is one of the biggest problems, which is hard to fix at a certain time. So therefore, if anyone's ever told you have gum disease, if your breath smells, if you have bad breath, and you feel your teeth are loose, and if you have space between your teeth, go see a dentist as soon as you can. Because if it's at the early stages, we can't fix it. As it progresses, it becomes very, 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 very difficult to fix it. So don't wait till that time. Okay. Try to make sure you fix this. Okay. Medical conditions which doctors don't tell you about. Of course, you need to fix your diabetes. Of course, you got to fix other kinds of problems. But when you take medication, there is always some effects. Okay. People who have diabetes, they take a lot of medication. People who have heart disease, like high blood pressure, like multiple things to lower your heart rate and to control your blood pressure, you take medications, correct? Also, psychotropic drugs. When you take anything for mental illnesses and anxiety, those drugs will cause problems in your mouth. One of the most common things they cause is dry mouth. And because of dry mouth, you don't have enough saliva, which cannot wash off all the food and bacteria that you have in your mouth constantly. That will give you problems. So find out, when you take a medication, you have to see what are its effects in your mouth at the same time. Okay. And if you are like, I don't know, sometimes a job, you can have problems. I've seen that happen. You can also have problems if you are an athlete and stuff like that. Those are other reasons where you can lose teeth. Again, losing teeth, I prefer you guys don't lose a single tooth. I would not want to lose a single tooth in my mouth. But God forbid, if you already lost teeth, I think you should find a way to somehow fix it. How to fix it is where people like I come in. You can go to just any dentist to see what they suggest. If they're not able to help you, then obviously take the extra trouble. I know I'm not close to many of you guys, but I'm still in New York City and it's accessible any every possible way. So as long as you're able to make a trip to come and see us, we're always able to help you. Okay. And if you have fear of the dentist, and who's not scared? No one wants drills and needles in their mouth. No, I don't want them myself. However, if I need to get it done, I'm going to get it done because I want to have a mouthful of teeth which I can smile, I can eat with, and I can be confident about myself. Okay. And that's pretty much what I'd like you guys to have as well. Okay. Number one reason why people don't go to the dentist is because of their busy life. They're always working. If you keep working, you have no time for yourself. Now, one of the main rules, like one of the rules that I have in my life, personal life, is I give time for myself no matter what. Okay. So if you don't care for yourself, no one else will care for you. And I don't care what anyone tells you. The only one who cares for you is you. Okay. You come alone and you go alone, and you need to take care of yourself. Okay. So make sure that you spend some time for yourself. If you have teeth problems, you go handle it. Don't wait for someone to tell you to go handle it. What are your options today? If you have missing teeth, broken down teeth, or you have loose dentures, or even have dentures, but you want to change it, what are some of the things you can do? You can do nothing. Okay. The first thing you can do is nothing at all. What happens when you do nothing? Okay. One of the things that can happen is your chewing will worsen. I don't care if you have 15 teeth and you're only missing one side of your mouth or only a few teeth. Whatever you say and do, like, right, regardless of what it is, as long as you're only biting with whatever you have left, it is only a matter of time. You will start having problems with the other teeth. Okay. It can take a year, it can take 2 years, it can take 5 years. Whether it takes place in 1 day or 5 years, the problem still exists. So inaction is not a smart thing. You have to do something about it. Okay. Chewing will worsen, and your bone loss, as I said, will continue. If there's no reason for the jawbone to create more, if your body to create more jawbone, especially when you're missing teeth, it is going to try to remove that jawbone and going to send it somewhere else. So ideally, if you're losing teeth, you will have absolutely no jawbone growth in that area. So the best option is to create something there as soon as possible, not a denture because it does not stimulate jawbone. You will have to do that only with dental implants. That's the only option for you if you're losing teeth, if you want to stop that bone loss from happening. Okay. If you want to avoid that pain, which I keep telling you, that if you're missing a tooth in between two other teeth, the two other teeth eventually is going to start having problems because it's taking the load of the tooth you're missing. It's doing all the eating and chewing for the tooth, which was supposed to help as well. And now that you don't have that, you're going to constantly be biting on the other two teeth, or maybe in your case, you have missing multiple teeth. Then you're using just a few other teeth in your mouth to bite and chew, and those teeth are going to get loose. Okay. People always say, okay, I'll put it aside. I'll wait for some more time. I got to go on this vacation. I got to go on this work trip. I got to do something else. What do you think is going to happen by you not making a decision now? I don't ever want you guys to think the price is going to come down. It's only going to go more because you will have other problems associated with this missing tooth. It is a lot easier to fix a tooth when it's broken and you come to the dentist that same day than you wait for 6 months, 8 months to come to him, or even a month to come to him because, or her, where they will have to take the teeth out. Now they have to grow extra bone. There's more extra work, and all of that costs money. Okay. And what else happens? Your confidence will obviously drop. You've put aside this fixing of your mouth for a long time, thinking, I don't have the time, I don't have the money. And as you keep waiting, or you think the insurance is going to cover, and all of those things, it's all great. You have insurance, bring it in. Let's see what happens. You have a state for insurance like Medicaid. I'm sorry, unfortunately, they are only able to help you with the denture. For them, all that matters is remove the infection, remove the pain, and then we will help you with something as simple as a denture too, so you can smile again. That's it. Okay. But can you smile comfortably? No. Can you eat with it? No. Those are problems associated with dentures. We'll talk about in a minute. But the point is your confidence will drop, which is what I'm trying to avoid for you and for everybody else around you as well. Okay. Option 2, you can do dentures. Again, dentures will give you back the facial support instantaneously. That's not a problem. But what dentures are not able to do is you can go back to normal life though. Dentures, once you put them out, sometimes they don't stay, especially the top dentures, they don't stay in the mouth. Okay. Same thing with the bottom dentures too. They don't stay in your mouth very comfortably because your tongue, you have to talk with your tongue and that wobbles. It's like a big piece of plastic in your mouth. And I've seen some people can't even have a small lettuce leaf or a small mustard seed stuck between your teeth because it's annoying. Okay. You want to remove it. Imagine a big piece of plastic stick in your mouth the entire time. Do you want that thing in your mouth all the time? I don't. I hope you don't also. You only do it because you had no other choice in the past. Today, with our technology and our skill set, we can do so many things. You can walk into my practice with a full set of dentures in your mouth, and I can let you walk out of my practice in one day. Okay, it doesn't happen that same day, but in one day, basically, I will have the denture gone completely from your mouth. You will have dental implants in your mouth, top and bottom, and you can walk with a full set of teeth that very same day, which was once upon a time impossible to do, and I'm now able to do it. And because you don't have dentures, you have regular teeth now, you can eat better foods. And then when you eat better foods, you pretty much avoid other kind of medical problems. When you avoid medical problems, you don't have to take all those drugs and medications that doctors give you normally. Therefore, you won't have new problems with your body. Okay. So dentures are great as a temporary solution. It is never a permanent option. Okay. And people just get used to it, adapted to it, and they think that's their life. It doesn't have to be a life anymore. Okay, so what are your other options, right? So full mouth implants, sure, it is one of the best options that you can have if you're missing multiple teeth in your mouth. If you only have five teeth in either of your arches, top or bottom, you should consider full mouth implants. Okay, if you have more than five, maybe we can do some implants and fix the rest of the teeth. But if you only have five or less, absolutely your best option is to take all those teeth out and put dental implants in. Okay. How does same day teeth work? Okay, let's talk about it for a second. When you walk into my office, the first thing we do is obviously the only most important thing I need is a CBCT scan and also a scan of your mouth. Okay, so once I have that, I'm now able to decide and tell you. And I don't take a small scan of just your mouth. I take a scan of your entire face. It tells me where you may possibly have some bone available for me to give you dental implants. Many times people cannot have dental implants because they have no bone, but that's not true in my office. I'm able to get you implants anyhow because I'm able to use some remote areas where I can get bone from. I can use your cheekbones to get bone from. I can find bone one way or the other. That's what I'm trying to tell you. So when you come to a practice like mine, because of this one particular scan I take, which is not very common, not everybody has the same kind of machine to take these scans. When you come to my office, I'm able to figure that out for you right away. And then I can take these digital impressions in your mouth and I can design your smile right on the spot. Okay. This is something that not everybody can do it. And I'm able to do it because of the advanced technology we use in our practice. Once I design your smile, the next time you come in is for the surgery itself. And this is a one-day procedure. You'll come sit in the chair. We will do your surgery, and then we will have you sit in our waiting room for like a good hour to 2 hours. And 2 hours later, I will have your teeth ready to go. Okay. And because our surgery is done with such precision, we use a lot of guides to do these things. There's less amount of pain in the back end. Okay. And I'm not going to say you don't feel anything. You definitely do feel some more soreness. I can calm you down as much as I can with giving you all kinds of good medication just for that one time. And then once you are comfortable, then we do the surgery. And the surgery is done so precisely and so quickly, we are able to finish a surgery in an hour and a half. People take 4 hours, 5 hours to do surgery. We do an hour and a half because of the technology we have and also because of our skill set. We've done so many of them. Only last year, we did almost 200 of these surgeries. So we are very, very fast and very able to do this quickly so you don't have so much pain. Understand this though, the longer time I spend doing a surgery, the more problems you will have. Okay. So the quicker I do it and the faster I do it, the less amount of problems I can expect later. Okay. Your swelling is less, your pain is less. A lot of other things are compensated because I can do the surgery fast. Doesn't mean that I do it fast and rough. I do it fast and clean because we know what we're doing. Because of the fact that we have our own lab, we can mill these things 1, 2, 3. So that's what happens. In an hour and a half, you're sitting outside, and then I bring you back in the room. I give you teeth, and you walk out with a set of teeth. The teeth I give you are obviously temporary teeth. you're going to be working with those teeth for the next, like you're going to live with those teeth for the next 3 months. And in 3 months' time, when your gum tissue and your jawbone completely heal and your implants integrate, I'll remove these temporary pieces and then I'll give you a permanent fixture, which will be made of zirconia and a titanium bar. And people ask me, why do I have to have this combination of zirconia and titanium bar? Zirconia is a beautiful material. Again, this is something doctors don't tell you. Zirconia is a beautiful material, but it's very, very rigid and solid. And if they don't know, they don't know. They don't do as many as I do. I do too many of them, and I've seen problems with zirconia alone. Zirconia will break. It's not a very great material. It's very rigid. It does not take stress very well. You bite and chew, you start seeing and start chipping and breaking on you. Okay. When you use a nice titanium bar, which is highly anodized and polished, that will give you the strength, and zirconia goes on top of it. That is the best of both worlds. Okay. It's a lot more money to make it, which is another reason why dentists don't make it. But again, I would not have something that's secondhand in my mouth. I want the best in my mouth. I want the best in my family's mouth, and I want the best in my patient's mouth. I give you the best that I think is worth that you're worth it for. Okay. So patients normally say it's way less painful than removing teeth, which is very, very, very true. People, when they remove teeth, they have more pain than having to get dental implants. Dental implants don't hurt so much at all. It's much more easy to do. I think that's the best option for people. Okay. Now let's talk about money. Okay. Let's talk about, can I afford it? How much does this thing cost? Every person is different. Every mouth is different. So I can't say it's going to cost you $5,000, $10,000, $20,000, $30,000, or $60,000. It's just not possible. Okay. Everyone is different. So I don't know what you're going to need, how much it's going to cost. The only way I will be able to tell you is when you come into the practice and I go and do the scan for you. Once I see the scan, I know the amount of damage you have, and I can tell you how expensive it's going to be. I also have to tell you this though, the longer you waited to get this thing fixed, the more expensive it's going to get on you. That's the truth. Okay. Obviously, I don't want you to clean out your bank account to get this teeth work done, which is why I'm able to offer you some form of monthly payment plans. And I know a lot of them do offer monthly payment plans, but are they able to offer you the plans that I offer you? I have over 15 different kind of plans I can offer you. Not every dental office can do that. Okay. The only criteria is you have to have some form of credit. Okay. And the credit scores vary. So based on your credit scores, you have to have credit scores from 580 to 850, right? So anywhere from 580 to 850, you will qualify. But people at 850, they'll be paying less money per month. People at 580 will be paying more money per month. At this point of time, you're not looking at how much money you're paying. You're looking at, can you make that payment every single month? If you can afford that every single month, then we have to change your treatment plan. Maybe you can't have all implants. You'll have some implants and some teeth and some dentures. But either way, it's going to help you one way or the other. Each plan is specifically planned for you. Okay. My team will sit with you and they'll figure out what's the best price range for you and find you a plan for that price range. And then you can come in like this. One of my doctors and myself personally, like there is no reason for him to live like this. He's 42 years old with completely broken teeth. But because of what I did for him, his life has completely changed. Okay. He can do a lot more things he could have never, ever done it. He has a new girlfriend. He has a better job and a life full of happiness. That's what I want for each and every one of you. Again, I know it's hard to achieve it, but nothing is hard as long as you put your mind and like your strength into it. I want to get this done and you will get it done. Okay. And this is your moment. Okay. So I know you spent the last 15 minutes listening to me speak something, right? But what does it do for you? If you are in this situation, if you are missing teeth, if you feel you need some kind of help, now is your time. I can make that work for you. Okay. Especially because next week is Thanksgiving and we have a special Black Friday sale for you guys. So I want you to take 100% effort to try to call the office and make sure that you can get the best deal or offer for you. Okay. I'm giving you $5,000 off on a full mouth, meaning top and bottom teeth together. I give you $5,000 off. It's only for full mouths, not for a single tooth, not for a few teeth. Okay. And if it's a single arch only, you'll get $2,500 off. But $5,000 is a lot of money to give away. I normally don't give away like this, but once a year I do this. So make the best use of it. If you can, it's $5,000 off. What does it include the first time when you come in? We do a complete evaluation of your smile, and I want to understand what you want and how you want it. You'll pay me for the CBCT scan, obviously, and that's the only thing you pay me for. It's $99. I'll come up with a digital smile design for you, and I'll tell you this is what I can do for you in a short amount of time. And if you like it, then we will offer you the flexible payment plans, and then we will personalize each treatment plan for you, meaning I will decide how many implants you should get. I will decide how your smile should look, and I will show it to you, and I want to make sure that you agree with that smile. And if you believe that I'm your guy to fix your teeth, then stick with me. In a matter of a month and a half, you'll be a different person altogether. When I say a month and a half, it's that I need to do a lot of pre-op workup. I don't want to bullshit to you. I'm not going to tell you I'm going to bring you in, I'm going to give you teeth the same day. As much as I can give you teeth the same day, I need to still do workup. I need to know. I don't know. It's not one size fits all. I know this guy in Vegas. He has three sizes: small, medium, large. Okay. Everybody has the exact, every small person will have the exact same kind of teeth. So all Asian people will have one kind of teeth, all white people will have one kind of teeth, and all like big people will have one kind of teeth. That's how he had it. Three different kinds of teeth. We're not going to do that for you. I'm going to customize the smile based on how your jaw should look and how it fits your entire face. Okay. Why this matters so much is because you can transform your daily life. You can speak to people, you can be comfortable, you have a better quality of life. You will definitely look younger and healthier. That is a promise from me. I've seen that happen to people time and again. And you will enjoy all the food again that you can eat. And this is a life-changing decision. I can make your teeth as white as you want, as dark as you want, as natural as you want. So I can do all of that for you with your help. I'll personalize that for you. Okay. So what are you waiting for? How do you claim this offer? And I'm going to show you right there. Okay. You can either click this QR code, or all the way on the top of the screen, there's a pin message. You just fill out that form and you wait for us to call you back. Today, all my staff have been ready. They're waiting for you. As you fill out the form and you submit it, you will start hearing from them today. It'll come from our office phone line. If you want, you can also contact the office, and then they can, the office phone number is right there. You can contact the office and then leave us a voice message. And then somebody today is definitely going to call you today, and then you can talk to them. I'm hoping that that helps you. Whatever I gave you in the last 15 minutes really helped you. I look forward to seeing some of you, if not all of you, in the practice. Next Friday is the big day for all of you. So try to make an appointment and show up to the office. If you have any specific question, I'm happy to answer right now. I'm going to go through the questions. If you guys have any questions, you can throw some more questions. In the meantime, I'll try to answer some of the questions out there from before. And thank you so much for listening. So somebody asked me, can I have to make a down payment on the house or inside the office? So the answer to that is, I'm not a bank, so you can still make a down payment. There are certain specific banks that help you with these things. So if you come to the practice, we are able to help you with that. Okay. So, but you should have some form of a down payment. The down payment can't be $50. It has to be much more higher. But we can definitely make down payment, and we can help you from there. Okay. Someone asked me, can I face this treatment step by step? I believe you can do this step by step, but it won't happen in one day. Then it'll take a longer time to get this done. And again, sometimes it's not very smart to do this step by step. Again, if it's money that's your problem, then you make a trip to the practice and we'll see how we can make that work for you. If someone tells you that you cannot get dental implants, I want you to rethink it again. I don't believe that's true. You may have bone loss, I agree. You may have osteoporosis, I may agree. But there is not that there's no necessity for you not to get dental implants. There's still options for dental implants. Maybe you don't have jawbone for me to give you dental implants, but I can use your cheekbones to put dental implants in. Again, this is a more personalized thing. You have to come to the office. I have to understand what your medical history is, and I'm hoping I'm able to help you. What if you don't have much of a credit score? That's a good question. Again, credit or no credit, as long as you can make big down payments, I'm able to get you some form of a loan. Again, you need to understand this though. You are making this transformation for yourself. So there has to be some struggle. It's not going to be easy, okay? Why are you in the stage, first of all? That's a question you want to ask yourself. And if you want to change, I can allow you and help you to change, okay? So I can give you the best I can to make it work for you. Be willing to put a bigger down payment. I can find you some money. If your teeth aren't fixable, it's not fixable. But just because it's not fixable, that doesn't mean you can't have new teeth. As I said, your teeth are bad, I would take them out and I would give you teeth on the very same day, which we do every single day in our practice. So just because your teeth aren't good, it doesn't mean you can't fix it. You can absolutely fix it. You just have to put that effort in by yourself. To first step is to show up at the practice. Second step is to want to have this dental treatment done. And the third step is to actually get the treatment done itself. I never said you should not use toothpaste with fluoride, but in New York City, I don't think you do need um, toothpaste with fluoride because of our water has plenty of fluoride. If you're not in New York City, maybe you should consider using some fluoride toothpaste or at least a fluoride treatment every few years at your dentist office. Very good. So you don't need to worry about fluoride, okay? So you have plenty of fluoride in your water. Dental insurances will pay for your initial consult, maybe, but not for your CBCT. So you still have to pay the $99. And again, if you have good dental insurance, they'll probably cover some of your extractions, any of your temporary prostheses I can charge. But it's really not a lot of dental insurance are different medical insurances. So dental insurances only have a maximum of $1,000, $2,000, or $3,000. So you need to figure out how much your dental insurance is going to offer you. If it's a state-funded Medicaid kind of insurance, they may not pay any of this at all. Okay. $9,000 down payment is a great payment to offer. I think start and you can come to the practice and they'll definitely find you plans where you can pay monthly payments of $300, $400 from there on if you need a full amount. Okay. Again, any amount of money that you have, save it, keep it, don't spend it off. If for your teeth, set it aside. Come to the practice. I'm there to help. We'll do whatever we can to make it work for you. I already did suggest Medicare and Medicaid will not pay for your full mouth dental implants, but they will probably pay for your cleaning once you have your teeth fully fixed. Is there parking around us? Parking is difficult. I prefer you take a train or a subway or the bus to get to us. But if you really do want to have parking, there are parking garages around us and also muni meters in Broadway. You could probably spend a couple of bucks, $2 or $25 for parking, depending on what you're comfortable with, and get parking. Your pregnant wife cannot do it if she's between the first and the third trimester. I would want her to wait, okay? But obviously, I would want her to finish her pregnancy and then she can come back to us and we can happily help her with the teeth. Baby first, okay? I think I'm done with all the questions. But again, guys, I want you to call the practice or I want you to click on the QR code and fill out your information. Someone will call you, and I hope I can make a difference in your life. Okay? Until next time, ciao.